most famous physical therapist on the internet.
Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet, in our opinion, of course. I'm Brad Heineck, and I'm exactly one half of the Bob and Brad crew. And here, Bob and Brad show, we got a crew too. That's another channel, by the way. And we got Chris the Pharmacist here. We are just excited to have him here. He did a lot of research, and he just knows this information on this topic, which is heartburn, acid reflux, and GERD, capital GERD. Best relief options, whether it's diet, over-the-counter, or prescriptions, meds, also known as PPI, I guess.
Yep,
we're going to
PPIs,
get into that.
Yep, proton pump inhibitor.
You need to know this information. If you have this or a family member, it's going to be a complete education. You're going to feel so much better about how to deal with this. So, Chris, heartburn, acid reflux, GERD or GERD, are they all the same, or is that three different diagnoses?
Nope, they're all the same. I mean, basically, it's that awful feeling you get in your chest. You just feel like it's kind of burning, just doesn't feel right.
Mm-hmm.
You're just uncomfortable, whether it's after you eat or maybe when you lay down at night. So your symptoms can come at different times of the day or at all times of the day. So it just kind of depends on how severe your case is.
So from personal experience, I do want to say one thing. If you have not had acid reflux or this problem and you're getting chest pain, don't guess and think that it's, I've got heartburn. Because you could be having a heart attack.
Yep.
So you've got to get in and get it checked out.
Yeah, that's
confirm what the problem is.
Yeah, you want to make sure that you have a pro. Make sure, because actually there are the symptoms, and some people are actually, they're undiscernible to a doctor, even in the ER setting, till they actually do blood work and look at troponin levels and all the things.
You're saying they don't know what it is?
They don't know what it is till they do some testing. So sometimes people can have what they think is heartburn, and it's actually a heart attack. Okay. And some people think they're having a heart attack, and it's only heartburn.
Right.
So until, so if it's an emergent situation, don't just guess. I'm going to take a couple of Tums and see what happens.
Right.
Get taken care of.
And there is another diagnosis that has similar symptoms, which I have, is costochondritis, which has to do with the ribs and the cartilage in your chest.
Yep.
But I know I get that pain here, and it's like, I've gone to the emergency 3 times, so I feel confident if I ever get it again, I know it's my costochondritis. But I'm thinking, boy, I bet you heartburn is similar, because my mother had it. It is. Same location. Same
nerve plexes, from that standpoint.
Mm-hmm.
So yeah, it's nothing to mess around with, guys. Right. If you don't know, get it checked out by the pros. I mean, those doctors are there to help you and make sure. And if it is just heartburn, there's a lot of things that we can do to help treat people.
And so, yeah, that's the good news about this. And, the more educated you are, the more you can self-treat or work with your doctor and, have a team effort that really is a prime way to work, so you feel part of the team.
Absolutely.
What are the stats as far as is it just an older person thing? Or?
Well, it can be. I mean, as we age, basically, with the stomach, we've got
should we?
I guess we can certainly.
Yeah, because, when I was looking this up, there was a diagram, and this really helped me. If you think of, here we've got the stomach is on the left side, right? So the food goes down, goes over into the stomach, and then from there into the intestine. What the technical duodenum?
Duodenum. Yep. Yeah, that's your lower.
So here we've got the stomach, and here the food's going down, and there's a sphincter here. And that keeps the food going one direction if everything is working right.
Correct.
And down in here, that's why I used red, we've got stomach acid.
Yep.
And evidently that's pretty potent acid.
Very potent. 1 molar. 1 molar hydrochloric acid. So.
Now we're talking chemistry.
There you
we
go.
got a pharmacist. So if you compare that to other like acidic food, this is
much stronger.
Okay.
It's not. I mean, a tomato is not going to withstand that. So
okay. So we got all this acid down here, which is healthy. We use it to digest, but we want to keep it there.
Yep.
So with GERD or acid reflux, somehow this stuff gets up and goes this way, and that burns, which is why you get the pain here.
Yes.
Does that help, Liz? Is that
Yep, okay. You're describing it really.
I feel pretty
really,
good.
Really well.
I feel like that's my contribution to the video.
All right, well, it's definitely improved my artwork, that's for sure. So no two ways about it. But yes, so I mean, when you get those symptoms, I mean, it can happen for I mean, there's certain foods that can trigger it, so it's going to be, and it's not everything. In the old days, we used to tell people that if you have reflux or GERD, you got to go to this bland diet where you're just eating like white bread and crackers and chicken noodle soup. And
How about milk?
milk actually is weakly acidic, and some people can actually get irritated by it.
Oh, okay. It's
But not always.
in the
But I
gray
mean,
zone.
but that's wrong. So that's the old news. The good news is you can eat a lot, just about anything you want, minus garlic, tomatoes, citrusy fruit, onions, those types of things. So
I'm dead in the water. I
Yeah.
can't eat grapefruit.
well, it's one of the no, if you have heartburn, but I mean, but there's medicines. We're going to get to better living through chemistry shortly. So,
Okay.
but I mean, it's one of these things that if we can avoid some of the foods that are triggers, we can kind of naturally bypass some of this. I mean, a lot of times, we may overeat. We have a high fatty meal. I mean, it's just this little muscle, the sphincter here, can get stretched, and all of a sudden acid will just kind of leak right through it.
Because this is
Yep. And
filling
what
up.
do you do after dinner? You kind of lay around, you watch TV. I mean, you're not necessarily sitting with perfect posture. I mean, if you can sit upright after you eat for a good hour, I mean, this is going to help because gravity is going to keep things going down in the right direction.
Yeah.
But, if you're in the lazy boy and you're flipping through channels or you're reading a book, and if this thing is a little bulged because you maybe had, the old 96er or something to that effect, you can get some seepage and you're going to get that heartburn.
96er.
Did you ever see The Great Outdoors, John Candy movie? Pretty fun.
I
96-ounce steak.
don't get out much.
Very big piece of
I
meat.
quit watching movies after 86. Anyways,
That's about when it was made.
well, I was on the borderline. So anyways, also, so if you lay flat, you're even more prone.
More prone to probably suffering. And so there's things that, people can use bed wedges, prop their bed up. So there's a lot of non-drug things you can do. But what it comes down to, and really the title of the video is, the proton pump inhibitors have really revolutionized how we treat these type of acid.
Proton pump inhibitor. So they put up a pump in your system?
Well, that's what, basically the easiest way to think about how we make too much stomach acid, we have pumps. And they're basically in the lining of our stomach, and it actually is what kicks out the stomach
you don't
acid.
mean we're
No, we're not pumping
surgically
it.
putting
No,
a pump
we're
in
not. We're not
it's
pumping
not
it
like
in.
a pump for more or not for morphine or for the
No.
So the pump means it's
it's
a
hydrogen, potassium. Yeah,
a
no,
natural thing that goes
yes.
on.
And
That
so-
was a little scary for me. I said a pump, and I thought, what are we going to promote here? People are putting.
There's no little robots in us or anything like
Okay.
that. No, it's
I thought they were going to put them in there. I don't know.
No.
Okay.
But ultimately, so it's what our stomachs do to break down food. So
Okay.
we need that. It has to, the business ends right here. This is the surface area, it gets into the intestines, nutrients go into the body. I mean, that's the quick and dirty answer. But the reality of it is a lot's going on. So your body is making, a lot of people that have reflux or even other stomach kind of conditions are making too much stomach acid. And as a result, so we're getting it, it's seeping out in the wrong direction. We're getting the heartburn. We're getting the discomfort. So if we take these types of medications, like omeprazole or pantoprazole, like Prilosec or Protonix, these are drugs that suppress that acid pump. So your body doesn't make as much acid. So and realistically, when you take a tablet within about 20 minutes of taking that, like with omeprazole specifically, your stomach acid has been reduced by 80%. So it's very thorough.
So what about? I heard people take Tums over the counter.
Yeah, and that's a neutralizer, so it works differently. That's calcium carbonate, and so it's kind of like, so if you have you've had acid in a little cup and you threw some Tums in there, it neutralizes it, so it's not as damaging. So that works a lot faster than, say, a proton pump inhibitor, because it takes about 5 to 7 days for the acid levels for you to perceive. If you have a lot of reflux and discomfort, there's irritation going on, and it takes time to heal. It's just like any other wound at that point. So if the mucus is kind of irritated.
So the tissues in the throat or the esophagus are actually physically irritated and little
Correct.
lesions in there.
And they can be, and if untreated, it can go to a myriad of very serious disease, as bad as cancer.
Ulcer
So
too?
you can go ulceration, and if ulcers are left untreated, it can become stomach cancer, esophageal cancer, bleeding varices. There's a lot of things out there that you want to make sure you see your doctor and you get treatment for this.
So the first step, I'm thinking, I don't want to take the pills. Maybe diet. Like I know my mother, we had to take citrus out of her diet, and it seemed to help.
Yep.
And And actually, she was taking, I don't remember, you remember.
Yep, she was on ranitidine at one point, and then
And I-
we
yeah, I
switched her
think-
to famotidine. And,
Yeah,
yep.
and I'm not
But
sure
I think she's on
taking.
omeprazole.
Yeah, I'm supposed to know that. It's my job.
That's all right. That's what you have me for.
I got it written down. Yeah, that's exactly right. Anyways, so you may be able to modify it or maybe be able to control it by diet if it's a mild
You
case.
can. Diet and exercise are huge insofar as
Exercise has something to do with this.
well, yeah, keeping a healthy body weight. So,
Okay.
because
Oh.
if we have too much body weight we're carrying around, the things that kind of keep everything in place kind of get stretched and displaced, and then so all of a sudden your stomach's not sitting quite right, and
Yeah.
then you can get reflux. So, healthy body weight is important.
Okay.
And
So so we work with our diet a little bit, and maybe it's not going. You talk to your doctor, and it's like time for meds. So this means we have to do prescription meds, or they're over the counter
nope,
meds.
all these drugs are many of these drugs are all over the counter as well, and so that's one of the problems that we're facing in this country is maybe the overutilization of some of these drugs. So we have to be careful with that. The reason that you see a lot of these packages over the counter, they're only for 14 days. We only want you to use it for 2 weeks, and if your symptoms aren't gone by that point,
Yep.
you should be discussing this with your doctor, because we want to make sure that there's something more serious going on that could be easily hidden by just simply taking months and months and months of over-the-counter proton pump inhibitors.
So you're not. Yeah, you're just kind of masking.
You can
it.
mask the symptoms.
And then maybe get a hernia or not a hernia, but I mean
it could be a variety of different things. But
Sure.
worst case scenarios. Let's say you had some severe erosive esophagitis. I mean, that esophagus is just raw and irritated. I mean, sometimes it can be the point where they have to do special procedures, or it could be triggering things like very bad disease states like cancer.
So at that point, if you got that esophagitis,
Mm-hmm.
it's probably going to be painful to swallow.
It is, but some people are so tough. I mean, it'd be fun. Actually, a buddy of mine's a gastroenterologist, but it'd be fun to have him on here. But a lot of these people just don't even recognize it, and it almost be silent in some cases.
Really?
Some people have tremendous pain, so it varies from person to person and
Okay.
condition to condition,
Mhm.
where along the GI tract it is. So there's a lot of different things that go into these factors. But the medications that we use to help to try and cut down acid are game changing, and so it can be life changing as a result of that. But we still have to be judicious with it. Want to use about the shortest amount of time to get you well, because there can be some consequences of overutilization of some of these medications
Sure.
as well.
You mean some side effects that
Taking-
cause other problems?
Yeah, you think about your stomach acid; it's one of your best immune defenders. So it helps to protect you against things like pneumonia, and so it's and other respiratory infections. So it actually, even though
Oh, because it goes up into the
well,
esophagus.
no, it's not. It's not even the esophagus. You just, it could be on your food or whatever, but it's bacteria.
Sure,
And so,
I see.
and it can't stand up to that acid.
Okay.
Although we do have acids that are bacteria that do stand up to those acids too. But
Those-
we'll talk
I'm
about.
assuming those are good. There's good bacteria too. I
There's good
understand.
bacteria. Yep. There's your.
That's another video.
That's a couple of videos probably.
Yeah.
So, but so when we have people with symptoms, we have to treat them, and we want to treat them and usually it takes about 3 months to get everything to heal up. And if you are 3 months and you're like, I feel great, I'm not having symptoms, at that point, your doctor may even suggest that maybe you can try and cut down or try and discontinue the product. But there's a double-edged sword with proton pump inhibitors specifically, is that they can cause a rebound in your acid production for about 14 days after you discontinue a product.
Oh.
So depending upon the dose level that your doctor puts you on for your particular condition, some people have to take it up to twice a day. Some people only take it once a day. Usually like to half that dose for a couple of weeks,
taper.
and then stop it. And like I said, recognize that you will probably have a little bit of rebound reflux. So you'll have to kind of muscle through that, or maybe use something like a Tums, or maybe something like a Pepsid, which is an over-the-counter supplement, to help try and cut that down and bridge the gap.
So the one thing, because I think once you see your doctor, hopefully you're listening to him. You got him as your quarterback or your coach.
Yep.
But if you're in that phase where I want to see if I can do this with over-the-counter meds, and you said they're typically 14 days, and then if that doesn't work, then you better
You should see your doctor.
So is there a acceptable and wise way to go in to get an over-counter med that you could suggest to people to see
Well,
if they can...
when people come and see me, we're going to talk. I'm going to try and get a gauge as to, how long they've been suffering, what makes it worse. We're going to see if it's always after meals. Is it when they lay down at bedtime? Is it all day?
So you're saying like if I'm a customer, I come in, I have not seen my doctor, I could go ask the pharmacist, I've got heartburn. Can you recommend anything?
Yep. And so we could kind of, see how long you've been in. He goes, yeah, it's been like 2 months and I've been feeling horrible. Every time I eat, I just get this horrible pain up here. It just doesn't feel right. I'm nauseated.
Yeah.
I'm like, well, we can try a couple of different things. And I would give them options. Pepsid is one. It's a little bit faster acting than the proton pump inhibitors, but the proton pump inhibitors are more thorough and they're more effective. So depending,
and you can get that over the counter.
yeah, they're all over the counter. These are all over the counter at this point. This is my arena. But we always say, hey, I'd like you to just try this for about 2 weeks, and if this isn't better, if you see symptoms worsening while you're doing this, don't mess around with this and wait for something to happen in a positive direction. Talk to your doctor because you're going to need the help. We got to figure out what's going on directly. And I've a ton of incidences where they go in and all of a sudden it was a big deal.
Do you have many people come in for advice like that?
Yeah, all the time.
Okay.
So and we're very, we want to talk to people. That's what we're there for. So hopefully we can give them some temporary help unless they need more thorough help from their doctors.
Which is something, we're getting to the end of the video, but this is something I didn't know because
You're
go to
healthy.
the farmers very much because I've been pretty healthy, but I didn't know that you could go. I just get a lot of my advice from Chris. I talk to him about something, he tells me, and it's like I remember I had a skin thing. I says, I got to go to the doctor to get something for this, and he gave me a little over-the-counter advice. I got it. It was gone. It's like, a pharmacist. They work. I mean, a pharmacist and a doctor really need to work hand in hand, and they can.
Oh yeah.
You can eliminate doctor visits by doing some
I don't think we can eliminate. We can help out when it's something simple.
In my case, it was a simple thing. It's like, I don't want to go to a doctor because of a rash. I just need something to put on it.
Yep.
And you help me. And like this could possibly stop a doctor.
Yeah, I think the use of over-the-counter medications, I think, is very, very effective, and I think it has its place in therapy. But again, we have to be careful because if we're older, if we're smokers, there's a lot of things that could be triggers that your doctor really needs to address these things. And long term, as we age and we take these things for long periods of time, we've found that there is a higher risk for osteoporosis. So, might want to maybe take a calcium supplement if you're on it, specifically calcium citrate versus calcium carbonate. Because the carbonate needs the acid to break down. So if you're reducing the acid environment, you want to use something that's bioavailable.
Overlap, and we don't want to cause another problem with
exactly. So we have to be mindful of other things. Like I said, it's disease state management too. We can see if you higher risks of what they call Clostridium difficile, which is another very bad intestinal bug.
Ooh,
that when our stomach, there is a correlation with long-term use of these medications. So we have to be real careful, and that's why your doctor has to be involved with your treatment plan.
Sure.
So coming in and seeing me is nice and I enjoy it, but a lot of times we have to make sure we do the professional punt and hand it off to the pro. So whether it's your regular physician or a gastroenterologist, these guys are the ones that really know, and they'll turn you back to me and we'll talk about proton pump inhibitors at length, particularly if you end up on a prescription, to make sure you're using it as long enough. What's the best tapering strategy if that's and you should always, when you're talking with your doctors, what's going to be the end game here? Am I going to have to take this forever? And we're finding that about 27% of the people do. So there are, so your doctor has to mitigate those risks for you.
So you're saying almost 3/4 of the people eventually can get
off. So if they're eating well, losing a little bit of weight, watching what they eat, minding the type of things that they eat.
Maybe get a wedge to sleep on.
Mm-hmm. Smaller meals multiple times a day sometimes seems out grazing versus gorging kind of thing. So there's a lot of things that can be done that do not require medicine, but a lot of times they're there for you if you need it. But just realize that long-term use does have some consequences. So we have to be mindful of that, and you want to work with your doctor to do the safest, most effective plan. See if there is an exit strategy for you so we don't have to succumb to some of these risks that could be associated with long-term use of these medications. So we've got to be very, very careful.
I'm feeling better already.
All right. Well, there you go. No reflux for Brad.
Thank you for listening and watching, and we'll be back with another exciting episode with Chris.
Have a good day, guys.